We Thanks, Zoe. We are going to own that. Let me just close this. I apologize. There we go. Okay. We're gonna own that we are not in a place where we thought we would be with this AODA toolkit in terms of its prettiness and its readiness to be completely unveiled. We are in a holding pattern right now. We feel very confident about the information that we've secured, the research that we've done. As I noted a bit ago, we have spent really the better part of a year building this toolkit out and identifying the resources for it. As many of you know, Debbie Mollendorf, who was with us for the first four-ish months of the year, this was really her full-time job for almost 4 months, and she worked incredibly hard and had way more patience than I certainly would have to locate, to vet, to compile, and to help us with a framework so that we could continue the work moving forward after Debbie retired. So we're so grateful for all of the work that she did. We also can't wait to have it look lovely and be able to send it out to her. We're in the process in the Health and Wellbeing Institute at Extension of completely revamping and redoing all of our websites. And so that is what our holdup is at this point in time. We had expected to do a brand new website rollout for the Institute in September. It is November. We are still not rolling out those websites. And that is the way things go in the world of technology and all the other spaces, right? So we have gotten a sneak peek at what our websites look like, and we are really, really excited about the changes, the just the structure, the usability, the readability. They are going to be so user friendly, and couldn't be more excited about that. So you all will get to see those when we are able to unveil them to the public. They just late last week where we were all given a link to be able to see them internally and make our own sort of last minute adjustments and edits. So we're getting there. With that, though, we have not been able to build our toolkit in that platform because the platform hasn't been made available for that yet. So what we have for you today is unfortunately not a beautiful web-based version, which we had envisioned to be able to share for you today. But instead, what Zoe and I have done is compiled an outline in an attempt to make it somewhat more concise, because the tool that we've been using as a team, so we have a team of educators, myself and Zoe, that have been working together to build this toolkit and identify these resources out. So the document that we have is really quite large and full of tons of information. And we knew that that would be it's overwhelming for us. We've reached the point, our team sort of put a timeout on all of our conversations until we can get it built into that web-based format, because right now, when we just look at the content simply in our document, there's just so much. So we are anxious ourselves to get into that space. So what Zoe and I did today, or to prepare for today, was to really create an outline. The outline itself is still 7 pages long. So it's still large, but we created an outline to walk you through the different categories of information that we have been working on curating. So hopefully you're able to see my screen here, and I'm just going to scroll through it. At the very top of our outline, we have this wheel that is what is a graphic that we're utilizing, at least for now, to help us conceptualize the different categories of information that are contained within this toolkit. What I will draw your attention to right away is that all of the spokes on the wheel really revolve around engaging youth. And so that is the focus for this AODA prevention toolkit that we have created, is that it is a tool and a resource for you as you are engaging youth. It is also a tool intended to be a tool and a resource that youth can utilize as well. So instead of sending you all out on a Google goose chase of trying to find and locate information as you are seeking to address AODA prevention or even just AODA topics in your communities, and again, not just yourselves, but as you convene teams of youth to embark upon this work in your communities. We want this toolkit to be a repository of vetted resources and strategies that you can utilize to go out and begin to dig into this work. And so we have created, again, this wheel with the categories that exist here. And then we're going to walk you through what we currently have on in our outline and a handful of the resources and tools. Again, we took a very, very large document and shrunk it down to 7 pages, which still feels, when I met with Zoe this morning, I was like, Zoe, the outline is still 7 pages. Like, that's a lot of information still in an outline. But we decided to leave it as is instead of shrinking it down so you could get a bit more of an idea of what we've compiled. Our other objective for today is to really seek feedback from all of you in conversation around what is it that will make this toolkit a really valuable resource for all of you. So again, we'll walk you through the outline we've created and the different categories. We've specifically, Zoe and I have specifically identified some spaces that we think our team could utilize some feedback from all of you on how to make it effective for you. And then we'll be excited, hopefully early at the beginning of the year, to launch the website and the toolkit and make it available to all of you. Everything that we do in Extension, we consider living documents. And so this document will also, and it isn't even really a document, it is going to be a web-based resource, but this toolkit will be a living, breathing document that we will be updating, we'll be reviewing and editing and hopefully making valuable for all of you. As we curated these resources, as we developed this toolkit, we really had local and tribal health departments in mind, as well as our local extension educators and team members that are working out all across the state of Wisconsin. So you are the audiences that we had in mind as we were developing this. And again, of course, the youth that you are working with in this space as well. It'd be important for us to also note Jen Ball, who's not on the call today, but she is our communication specialist that joined our MCH team. She has also spent some time reviewing the tool and in the bigger form and giving us some great suggestions and ideas around plain language, also readability and accessibility as well. So as we roll it out, we again hope that it will be beneficial for both local tribal health departments, our extension educators around the state, as well as the youth that they are working with and serving. So keeping those things in mind as we dig in just a little bit here. First part, again, some of this structure is helpful for us in this outline. Some of the things you'll see here are tools that we will utilize as we are building the specific web pages around this site and this toolkit. And I've already referenced here that a site has been created or will be created by extension educators, and we will also be responsible for maintaining and updating this space for all of you. Engaging youth. The first section, we just want to remind you all that all of this work is intended to center around or revolve around engaging youth. Really, that is the center of it all. It is what we have been working with you all on this adolescent well-being project for the last 2 years, providing technical assistance, reminding you of the value and importance of centering and engaging youth at the beginning. Our goal is to help provide resources and strategies in this section that help you access the tools and strategies that we've been talking about over the course of the last couple of years to help engage youth. So as we also remember that working with youth is our key goal and strategy and not working for youth. So again, one of the things that those of us working in youth serving fields have learned is that anytime we engage youth and they are part of the process and not that we're not designing work for them, but instead with them, we are going to be so much more successful in that space. And so, again, this work is all intended to center around these spaces. We'll provide an opportunity for incorporating feedback in planning and decision-making processes, as well as implementation stories in this engaging youth space, to be able to capture those successes that are happening in your communities, and both through local tribal health department work, but as well as with our educators as well. In the Engaging Youth section, we'll also have a link to our Youth Engagement Resource Guide. Taylor Seal talked about that last week, and they are so close. They are making rapid progress on having that also be available and ready for all of you to use. So of course, we want to utilize the resources that exist in our space. We'll also have links to our Youth Advocates for Community Health resource tools. There's a toolkit and a guide there. Really, that's a framework for working with youth. And then the NAMI Raise Your Voice program, which can also be a fantastic resource in collaboration with schools as you are seeking to engage youth and work with youth on these AODA prevention strategies as well. So again, as we work through each one of these sections in our discussion today, we'd love to pause and just invite you to share any suggestions that you might have, additional resources or tools that we may be missing. As we dig a little deeper into the resources, we did provide a little bit more of a concise list in some places, because there are some sections where the resources are pretty robust too. But any thoughts or questions about engaging youth and what might be valuable for your teams as you embark upon this work? Zoe, I'm wondering if we should put our Padlet link into the chat. Let's do that. So we also created a Padlet because we know sometimes, especially when this group is a little larger, it's a quiet group. So we'll put our Padlet link into the chat. That's a space for you to also be able to share your feedback and your thoughts. If you don't want to unmute, if you don't want to put it into the chat, you'll be able to add your suggestions and your thoughts in our Padlet as well. So Zoe, you'll get that link into the chat. Let us know if you have any issues with that. Fantastic. Thanks, Zoe. So when we go back up and now look at the spokes around the wheel, those will be the pieces that we are going to dig into next as far as the resources that have been curated in our prevention toolkit. So define is the next section that we are going to start with. This is a space where we're just not going, we're open to suggestions always, but we're not going to dig real deep into that space today, simply because we know that there's just a robust amount of information, but a variety of the categories. So again, thinking about the audiences, the broad audiences that we're creating this toolkit for, this toolkit, again, could be a resource that you share with the youth that you are engaging with. So as they are embarking maybe on a youth advocates framework, and part of that is to really define or identify situations in their community that they would like to address and come up with appropriate strategies. It's our hope that, again, you could give them the link to this toolkit that has a wide variety of vetted resources and information for them to dig into, and to know that these have been specifically curated in a way that will give them accurate and credible information so that they can embark upon their exploration process for building out the work that they would like to support in their communities as well. So with that being said, there's a wide variety of information in this definition section that will be presented in our toolkit. So everything from just the global definitions of mental health and substance use, some core data around mental health challenges in adolescents, some definitions around adverse childhood experiences, and links to additional readings and further research. We'll also, in this section, contain information on various substances and data related to Wisconsin-specific resources around specific substances that are concerned. So thinking specifically of vaping resources, the changing climate of tobacco use in Wisconsin, and as well as teen drinking and alcohol use as well. Our team felt really strongly about also incorporating a section here around addiction and the brain, providing valuable information around the impact of substance use on the developing adolescent brain. So again, as our youth are digging in around information, we felt like this could be a really great place for them to begin to explore and be armed, if you will, with some valuable information as they think about how they want to frame the work that they are supporting in their communities and their schools as well. We also know that language matters. And so a very specific section was created by our team around reducing stigma and creating awareness around the language that we utilize in the prevention efforts and prevention fields. And so we'll have links to misconceptions as well as language around addiction and other resources for reframing communication strategies in this space as well. Again, hoping that it gives our youth as well as the adults working in this space important information to support their work, but also important information to arm and inform our communities as well around this work. So again, definition section, we feel like this is a really robust section in our toolkit. If there's anything in particular that you feel like you would like to contribute or you see that might be missing from this section, again, always feel free to put that information into the Padlet, make a note in the comments. You can also unmute and share that openly with us in this space as well. Zoe can correct me if I'm wrong, but I would say that the space that has maybe given us the most conversation and maybe even the most challenge for developing this toolkit has been the framing section of this toolkit. There are, as you all know, there are a wide variety of frameworks that exist around the prevention topic and just public health topics as well. And so our team spent a tremendous amount of time evaluating the different frameworks that exist, identifying the frameworks that we thought would be the most valuable in health department, in extension spaces, and also, again, providing some context for youth as they begin to think about what is it that needs to happen as we tackle these big and large topics and concerns that exist in our community. And so this list could be extensive, and our list was extensive to start with. And we have really narrowed it to the best of our ability down to some really key and core frameworks that we thought were really critical as individuals and groups really dig in around this topic. So providing some framing around public health approaches, social determinants or social drivers of health, information on defining again that framework and what does it mean when it in terms of AODA prevention, risk and protective factors. There's a lot of framing that happens around that space, and we wanted to provide some valuable context and clarity around that topic. The strategic prevention framework is a particular framework that our extension staff have received some training in and are really equipped to go out into their communities to provide additional strategies around. So it was important to us to also include that framework in this space, knowing that our extension staff are building their skills around bringing that framework out into their communities. The continuum of care model, the 3 levels of prevention, harm reduction, those are spaces that we all looked at building some significant frameworks around. And we didn't build the frameworks, we built the language around those frameworks for the use of this toolkit. I'm curious from all of you if there are additional frameworks that you use in your communities that we may have missed as we were curating this list of frameworks and strategy to help us build out then the next further sections, the strategies section. Any additional frameworks you all are using? And so if you're looking at the Padlet, if there is any population going onto the Padlet that might be valuable for the purpose of just conversation in this space, feel free to share those out as well.
We got one comment saying that it would be nice to have a list of resources to engage youth included, such as the NAMI resource.
Yeah, that's fantastic. And so in our engage section, uh, we will have we will have a list of those resources. They will all be hot linked in this toolkit. Again, we've really waffled back and forth just to set the stage for what has taken a year's worth of developing. What would be the most useful for our local and tribal health departments, as well as our extension educators? And while sometimes we know that just curating a list of additional links and resources doesn't feel valuable, we also felt like using this strategy with the wheel and centering it around engaging youth and having those direct links out. Our team decided that that was the direction or the avenue that we wanted to take. So everything that you might need in this space, ideally everything that you need to engage youth around youth prevention, as well as to give yourself a space to go to. We wanted this to kind of be a one-stop shop for you, both in engaging youth and how to engage youth, but then also a place for curated resources, vetted resources around youth prevention topics as well. So thank you for whoever shared that comment. We appreciate any comments that you have, any suggestions. All will be taken to deep consideration. Our team that has been meeting throughout the last year meets again tomorrow morning. So we specifically scheduled a meeting to follow up after this meeting today to begin to incorporate all of your thoughts and ideas as well. Great. All right, so the next section that we are looking at sharing is around identify. So we are framing identify in terms of resources for finding statewide and national data around youth prevention and youth substance use. So we've got a wide variety of data resources that have been curated here for you. Again, all of them will be hot linked with some definitions and descriptions of the type data that you will find at these sites. We probably not accidentally have county health rankings and roadmaps at the very top. We utilize in extension that resource very robustly. Substance use dashboard from DHS, excuse me, National Survey on Drug Use and Health. And as you can see, we are now getting into the space where some of these sections in the toolkit get quite lengthy, but we wanted to provide you with a robust and wide variety of data sources, again, that you can utilize. We strongly encourage turning youth loose on these data sources as well, both your local data sources, but as well as these statewide and national data sources, and letting them dig into the data and hearing what the data speaks to them and letting them bring that to the table as well. I don't think there's anything more exciting for me in the work that I do when I get to hear youth, the youth lens and the youth perspective on the data and what it means to them. It often reminds me how different my lens on the data is and what I see in the data, and that data speaks different things to different populations, to different age groups, to different professionals. And so again, as we look to engage youth, getting their lens on both local, state, and national data is so important. And so again, I've said it multiple times today. Taylor, I love your megaphone there. Right? Getting our youth into this data and hearing from them on what they see in the data and how they believe utilizing the data will best serve their peers, but also serve their communities as well. Just building this toolkit, I just also can't say enough that the idea that we are going to hopefully be giving our local and tribal health departments the tools that they need to really robustly engage youth, both through the youth engagement resource as well as this toolkit, and to think about what may happen in communities as a result of being able to engage youth in this work. That's where the real change happens. It's really where the real change happens when youth are involved in this work. So excited to see more. All right. I apologize. I just got a direct message. I just want to see if it's relevant here. Okay. I'll circle back to that later. All right. So again, if there are other data sources that you utilize in your communities or in your data mining, basically on that statewide or national data space, we're obviously not going to put your local data spaces in here, but we do have the Youth Risk Behavior Survey in here. So encouraging your youth and your teams to go out to the DPI website to look at that statewide data, but also remember that your local YRBS data is a really, really valuable and rich source of information as well. All right. Our next section is around training. So this training section is intended both, again, for adults as well as youth. There are options in this training section for building skills and strategies around youth prevention and AODA prevention more broadly. And so we will have some really key resources in here, places that provide comprehensive training in the form of maybe workshops and framework training, as well as more what would be deemed more as professional development trainings that are more time limited and don't require ongoing follow up with those trainings. So kind of those one and done trainings that exist there. We have a lot of technical assistance or technical transfer centers, information transfer centers around our nation that are dispersing and providing information out to wide varieties of groups. And so we will have links to those training centers, technical assistance centers, as well as, again, descriptions to what they can provide and what you might be able to tap into them for additional resources for your departments and your efforts locally. Again, if anyone has specific training strategies or resources that you would like us to be aware of and add to this toolkit, we'd be more than happy to take those from you. The strategize section is also a section that our team has spent an extraordinary amount of time around developing and curating evidence-based strategies and resources for your teams as well. So we have spent a lot of time reviewing and vetting, identifying strategy resources that would be helpful for you. One of the things that we've also spent a lot of time on is this topic right here, navigating offers or recommendations. It could read that are not supported by evidence. We actually have engaged a professor on campus, Dr. Brett Shaw, who works in this space of communicating around sort of difficult conversations and topics, and has specifically done some research around these specific situations when someone in the community, maybe even a professional, comes to you with a strategy that they think would be a good strategy to utilize around youth prevention. Oftentimes those are centered, we see those centered in some of those scare tactic resources. And we know that some of those strategies actually can do more harm than good. And yet navigating those conversations can be really difficult. And so we've been working with Dr. Shaw on campus to identify the best tools that we can give to you to help support you in navigating those really difficult conversations. And so we have some additional conversations yet to be had with Dr. Shaw around that, looking at developing and sharing a decision tree with you that you can utilize. So taking in the information from the well-intentioned community member or professional, and then the steps that you can take to evaluate the suggestions that have been offered, as well as the options that you have for engaging the well-intentioned individual or group around thinking about what other strategies or resources might be better suited to addressing the need that exists in the community, that is more rooted in evidence and it would be more helpful and not harmful in your communities. So looking at some topics here around harm reduction, so providing some tools that help you to think about how to engage around harm reduction. Tools for evaluating guest speakers. We actually have extension professionals that have curated and developed specific tools for evaluating a recommendation for a guest speaker. So we'll be sharing those tools with you in this toolkit, and we're really happy to have that, as well as a script and or a decision tree that we'll be developing with some common scenarios that exist in communities. Again, doing that in collaboration with Dr. Shaw at UW-Madison in that space. We also are eager to hear about the examples that might exist in your communities where you've had to encounter that. So as we look at navigating or developing some common scenarios, we'd love to take those directly from you and create sort of those scripts or those decision trees around that as practical examples of what you've had to navigate in your community. So again, in this space, we would really welcome some conversation or some examples. Again, you can put them in the Padlet, put them in the chat. But what might be some examples of well-intentioned suggestions or recommendations that you've had to navigate in your communities that you knew were maybe not supported by evidence and potentially more harmful than helpful? If you've got ideas of those, we'd love to hear them now. I will also just say we'll keep the Padlet link open, and Zoe, maybe we can even share the Padlet in the newsletter. So we'll continue. Again, our hope is to have our web-based version of this toolkit done by the end of this calendar year, but the newsletter will go out at the very end of November. We could take additional feedback or thoughts in that space. As we've noted before, even once we roll the web version of our toolkit out, it will be open for suggestions and recommendations and updates on an ongoing basis as well.
One comment in the Padlet.
Oh,
I'll just
great.
share it. Resources we can share with schools would be helpful, including more prevention treatment approaches they can take instead of punitive approaches. It's a great comment.
Yes, that is a great comment. And I think that touches a few different spaces and maybe a perspective we haven't really dove into deeply on our team. So thank you. That's exactly the kind of thing that we were looking for as we just shared this skeleton outline with all of you, what tools will be helpful. So that's great. Our team will consider that and make sure that we curate some specific resources and language for you in that space. Thank you. So the next section that we have also been spending a fair amount of time wrestling with is the funding section. We would love to hear from all of you what would be helpful in this toolkit regarding funding opportunities. One of the things that we tried to be mindful of as we were creating this toolkit is the amount of time that our extension team will have to update and to maintain this toolkit. And we, I think, came to the conclusion that it's not likely a space where we will we will house requests for RFAs, requests for applications from grant funders, simply because of the true like frequency that would require updating and maintaining, and for accuracy also. But with that in mind, really thinking about what instead would be helpful for you in this funding section. So we at this time are looking at, of course, curating spaces where grant funding may be posted. So again, the SAMHSA website, what's a direct link to locate SAMHSA funding for those pieces, Wisconsin DPI, funding resources related to youth AODA opportunities. That would be another place that we would be able to provide a link to. But if there are other ideas that your team has around how this funding section can be most valuable and beneficial to you, we would love to hear that feedback from all of you. I think this is maybe the section that we've been stumped by the most. Others have taken a lot of time and energy as we have been refining them, but this one has really kind of stumped us up to this point to think of how to best utilize it for all of you. So again, feel free to share your suggestions or ideas in that space. And a final section in the toolkit is a place where we would like to curate a sharing section, essentially making this a hub educators and public health departments to see what other counties, cities, and states are doing and to share what works best for them. Potentially, this could also be a place where we would post maybe announcements of funding opportunities or new information of awareness that others may not readily have access to or be fully aware of. It also could be a space where we provide some skills and some strategies around writing your narrative and how to share your story with your community, or how to share the story even in this space. And then a space to maybe engage with other professionals, again, our local tribal health department professionals, extension professionals, and receive feedback. So to post ideas, essentially potentially making it a communications board, place where that engagement could happen in a back and forth manner for those that are engaging in this toolkit space. But again, if others can think of strategies and suggestions for how we could make this sharing section really robust and valuable for you, we are open to those thoughts and ideas as well. Up screen sharing so I can see you all just a bit better. And with that, Zoe, do we have anything additional in? We had a couple of question prompts in our Padlet. So if you haven't linked into the Padlet, you can go ahead and open the Padlet again. Again, we will keep that link open and encourage you to share your feedback and your thoughts in that space. Once we launch the toolkits completely live, we will likely be back in front of you to seek feedback, to seek thoughts and ideas, suggestions and recommendations for that toolkit as well. I'm also going to put our evaluation link for today's session into the chat here. That is another space for you to provide your suggestions and your ideas, also a place for you to let us know how we can best continue to serve you as your technical assistance provider. We have one more session this year as far as an office hour session. Jen Ball will be joining us in December, and she will be digging in a little bit more deeply around messaging. So her December session will give us an opportunity to do some hands-on practice with crafting messages and communicating out the work that we are doing in our communities, and maybe directly with youth as well, using some of those really creative and engaging social media and communication strategies that she is so incredibly skilled at. And she shared those with us a couple of months ago during an office hour session as well. So we intend for our December session to be kind of a hands-on opportunity to dig in and practice some of those things that she shared with us as examples. Like I said, in her office hour session a while ago. If anyone else has suggestions or comments, ideas that they would like to share with us, again, now is the time. If there's anything else that we can provide with you, if you have other questions that aren't necessarily related to the toolkit, but related to technical assistance and needs that you're seeing in your community, Zoe and I are not in a hurry to hop off. Taylor's also on the call, so feel free to unmute and share your thoughts and ideas with us. Otherwise, we'll end a little bit early today and let you have a few more minutes back in your day. Thanks for being here. Thanks for exploring the toolkit outline with us. And we look forward to your ongoing feedback as we get ready to launch the web-based version of it. Thanks you all for being here. You are welcome as well.